Let me ask you a question. How would you like to have healthy knees for your whole life, okay? Or if you don't right now, how would you like to avoid or actually cancel the surgery that you're so desperately waiting for because there's just no answer out there? Now understand something. The majority of the population is always going to opt for the shortcut to grandma's house, and they're going to pay for it. They're absolutely going to pay for it. Because what people do not get, it's all about inflammation. It's all about fibrin, which is scar tissue that your body creates to stop the inflammation from spreading, to stop the parasites from coming in to that weakened area. And it's all about calcification from the calcium that's actually going to come from your bones to buffer down the acidity and help to buffer down the inflammation. Remember something. You'll never have pain, you'll never have swelling, you'll never have redness, you'll never have heat, and you'll never have stiffness, okay, if you've got a healthy knee or a healthy joint anywhere. And most of you don't understand, but when you go for knee surgery, you're going to go for more surgeries. If you go for knee surgery, believe it or not, the occurrence of people having to have low back surgery, okay, are you ready for this? Or hip surgery because of the knee surgery. Oh yes, I know what I'm talking about. We have been offering a money-back guarantee, okay, understand this, for 30 years, that you're not going to go to surgery, whether it's your knee, your shoulder, your spine, okay, because guess what? Whether you believe it or not, the calcium comes back, the cartilage heals, the ligament heals, the tendon heals, and what medical system has decided to totally abolish is that the body is a miracle healing device if you do the right things. So understand something. I tell you something. I have seen so many people jump out of the woodwork, okay, to get in on this knee problem. Everybody's got knee problems. Do you know why? I'm going to make it really short. If you go into my library, I can prove all of this. Everybody's got knee problems because they were pooping in their pelvis. That means that they have leaky gut, which is leaky large intestine from glyphosate, antibiotics, and all the inflammatory foods that we're eating today that we call normal. And understand something, those tight junctions in your intestine have opened up and you're pooping in your pelvis. And guess what? That infection creates inflammation. And guess what? Gravity pulls it down. And what is the first joint that it hits? Well, it hits your hips. And if you want to go back 25 years, you'll find there was hardly any hip surgeries. If you want to go back, okay, just even 15 years, you're going to find there was hardly any knee surgeries. Now that everybody's rotting out in their large intestine and backing up all this SH, you know what, into their liver, and that's why people are getting low back pain all the time and kidney problems because you're pooping in your pelvis. It's going back into your bloodstream. Understand something. There's the first domino, and guess what? All of these so-called practitioners that are coming out and now talking about the knee, right? That are talking about the knee. Can we get a close-up, please? All right? So when we're talking about the knee, everyone, I want to tell you something right now. Your knee, okay? How many of you know that if you're 1 pound overweight, I hope you know this, that you've got 4 pounds of extra pressure on your knee. That's right. Did you hear what I said? 4 pounds extra pressure on your knee. And guess what? How many of you are overweight? Guess what? You do know that they said that obesity is 40 pounds or more. And when I was younger, it was 10 pounds or more. Go figure, right? Let's make everybody feel comfortable. So understand, that low back pain, well, it's because your core is on the floor. And, oh, by the way, wait until you see the new song we wrote. Okay, it's called Pooping in Your Pelvis. You can't shake it like Elvis. So just, you know what, I'm not trying to make fun of it, but this is actually going to teach people, okay, what's really going on in their body, okay? Now, if you'll take a look at the slide behind me, okay? All right? Every year in the United States, 50% of knee surgeries are a meniscus problem, okay? Now, are you ready for this? 80% of meniscus surgeries are unsuccessful. How do you like that one, okay? And guess what? You may not have any pain, but now you've got stiffness, Okay, now you've got hip problems, or you've got ankle problems, or you've got a low back problem. That's what that actually does. And understand something, surgeries should be your last option. But guess what? Oh, it's another medical breakthrough that's going to cause you to break down, cause you to get a limp, then a cane, then a walker, then a wheelchair. You know where else we go. So let's take a look at this, okay? Take a look behind me here. So this is a knee joint, okay? This is a meniscus. Now, this meniscus is made out of cartilage. Now, you also have cartilage on the end of your bone right here. Okay, there's cartilage here, and there's cartilage on the end of this bone as well, being the tibia, right? Now, the meniscus is a thicker piece of cartilage, and guess what? It's like a shock absorber. But when it's moving, the synovial fluid in here, okay, is being pumped out evenly in here. And guess what? The reason why you don't have stiffness is the synovial fluid, just like oil in a car, is actually creating this smooth movement. You're not bone on bone. Listen, your synovial fluid has dried up from inflammation. And guess what else? And you're actually, when you have inflammation here, you're going to pull bone calcium, the calcium, from your tibia, okay, and your femur. And guess what? That is going to calcify in here. It's going to calcify the meniscus. Now, the meniscus is not gone. And even if the meniscus was down to 10%, it'll grow back. Did you hear what I said? It'll grow back faster than you can even believe it'll grow back. And it's all about circulation, and it's all about electrical conductivity, which I'll get into in a little bit here. So I hope you understand, most people are never told this. So let's take a look at this. Okay, so here we have the synovial membrane right here, this brown area. This is here is called the articular cartilage, okay, right here, okay. And then you've got the fibrous joint capsule around the outside to hold it all in. Joint cavity filled with synovial fluid is right here. So, and then you've got your ligaments and you've got tendons. But the reality is, this is how your knee is. And understand something, guys, all right? Oh my God, honey, there's no oil in the car. Did you not check the oil? What you're going to do is you would actually burn out the engine. And when there's no synovial fluid, you're going to have friction, you're going to have pain, you're going to have swelling, okay? You're going to have inflammation, you're going to have heat coming off of this. And all of that synovial fluid can come back so quickly. And what people do not understand is this, okay? It is the scar tissue, and you know what? Nobody's talking about this. And I've been talking about this for 40 years. When I first developed Wolf non-surgical, which is an elbow technique, and understand something, we've been giving a money-back guarantee for 35 years on knee problems. And understand, and we're not just doing Wolf non-surgical anymore, but I want to show you something. You see this? Can you get a close-up, please? All right, so take a look at this. This is called Wolf non-surgical. This is actually a body course that I have been teaching since I was 28 years old. This is better than any university, college course, physiotherapy, chiropractic, massage therapy, acupuncture. And understand, I'm 3 of those things that I just mentioned, and I don't do them anymore. And understand this, okay, that it's all about, guess what? Beautiful connective tissue drying up due to inflammation. It's a flame. So how are you going to get the circulation back? And how are you going to get the calcium back into the bones? Nobody's talking about that. Okay? Nobody's talking about that. But I'm going to show you something. Okay, here we go. So let's say, okay, let's say that this, okay, is your meniscus. You see how spongy it is? Now look at this. When I squeeze it, you see the water coming out? Well, that's what happens. When you have a healthy meniscus and you're moving, okay, you're going to have the synovial fluid coming out from the sides and in between the two major bones, and it's going to be lubricating it. Here's what happens when you, okay, your synovial fluid dries up because of scar tissue formation, inflammation, okay, and calcification. Because of scar tissue and the calcification blocks it, and the inflammation, it's a flame, so it dries it up, and it makes it like, see this? This is what happens. And then it's just like this steel wool. So now what you've got is you've got a cartilage that's full of calcium. Okay, that cartilage is even more like beef jerky. It's got no synovial fluid, so it's like you're rubbing on this, steel wool sponge. And guess what? It is absolutely reversible. It's absolutely reversible. Okay, so right off the bat, okay, if you want to know how to help yourself, there's a lot of people out there going, come to us and you don't have to have surgery. Well, understand, make sure that whoever you go to, that they're going to actually know how to cleanse out your colon. Because your colon's right here. And most people, their core is on the floor. And you're pooping into your pelvis. And it's called a pelvic bowl. Okay? And understand something. I want to show you here with bones. Okay? So, your large intestine starts right about here in the hip right here. Your cecum sits right here, just above the hip. And then it's got your ascending colon, it comes up to your ribs, across your transverse colon, but most of your transverse colon's fallen down by at least a few inches. But then you come across, and then you go descending colon, sigmoid, anus. Now, I'm telling you that you are pooping in your pelvis, and leaky gut is leaky large intestine, not leaky small intestine, not leaky stomach, and you're filling up what's called the pelvic bowl. This here is called the pelvic bowl, your pelvis. Now, you've got your hips here, okay, which hip surgery has gone up, oh my God, okay, in the last 20 years, hip surgery has gone up 5,000%. And that's because people are pooping in their pelvis and the infection's flowing out. And now you're creating the inflammation, scar tissue formation, calcification, and you're getting rid of the lubrication that's in your joint. Okay? And it's reversible. And we'll give you a money back guarantee that it's reversible. And if you go and read Reverse the Irreversible in my Perfect Day Guide, which is free, download it from pdgfree.com. Or go watch the masterclass, because I've done a beautiful masterclass called Reverse the Irreversible, and I show every joint of the body and what we do. And if you download bhnapp.com and go to the Evolve section and go into the masterclasses, you'll see the biggest masterclass library, and I will give you more free training than you've ever had in health. You will be wealthy with it. And guess what? You'll be smarter than the practitioner that you're going to see. In most cases. And I'm not putting them down. I'm trying to tell you that I've had to search the world over. I had to move the rocks to find these golden nuggets to string this together like a string of pearls for you. How can I offer a money-back guarantee on my consultations, treatments, trainings, unless I did my homework? Okay, so let's make this really clear. Okay, you've got your knee joint. Okay? All right, let's just do a bigger shot of me, please. Thank you. That's what I want, okay? So you've got your knee joint. And understand something. If you have problems with your knee and you're just starting to get stiffness, okay? If you're starting just to get pain in it, understand something. There is no old age, guys. I mean, I'm going to be 68 in 6 weeks, I think, or 7 weeks. And does it look like I'm limping? Okay, that is, you were set up, and it's all a lie. And you think the medical system's there to help you? Well, you just keep on going, and they're going to sell you off by the pound. And I'm not telling you that the people are bad. I'm telling you the platform, okay, was the greatest manipulation of humankind. And that's my personal opinion. So now, what you're going to do is you're going to take your knee, and even if you started doing this, watch, you're not going to have clothes on, you're going to have your knee bare, okay? And you're lightly going to go like this, because you're going to go, oh my God, it hurts. So just do this, or stroke it, just even stroke it for a while, just like this, and then stroke it a little bit harder, because guess what, even doing this, I'm getting the circulation going. And as I go like this, that's not hard. And then guess what, after about 5 to 10 minutes, I'm doing this. Now, you might think that I'm in pain, but understand, I am the master of my pain. I'm the master and can teach you how you can master your pain. And understand, pain is just a message that you are in trouble in that joint, that organ, that tissue. You understand? That's your body talking to you, and you're telling it to shut up when you do drugs or when you just try to forget it. Oh, I'm not going to talk about it. I'm going to pretend it's not there. Okay? But just by doing this, okay, just by using DMSO gel, okay, a little bit of DMSO gel with aloe vera, and putting that on your knee 3 times a day, and then taking what we call pain away essential oil and rubbing that every half hour to every hour on your knee, okay, we're going to get rid of the pain because we're going to decrease the circulation, we're going to decrease the inflammation and increase the circulation. Once the knee starts to feel better, you can use another essential oil that we sell, and our essential oils are pure, but they're cheaper than anywhere else. Check them out. And don't believe me, but check me out. Now, you can use what's called Muscle Restore, and that the pain away takes away the pain. The Muscle Restore brings back the integrity. If you've got a lot of severe pain on this knee, then I would use peppermint, and we have a very concentrated peppermint oil that you can put on, and that'll help to numb the pain out. And also, remember, essential oils get rid of the inflammation. They increase the circulation, so you're not taking something that's like a drug that's hiding the inflammation and the pain. Now, I'm going to tell you what we do. So I'm here in Ixtapa, Zihuatanejo, Mexico, and we have people flying to us from all over the world, and they have different joint problems from I need low back surgery, they say I need a hip replacement, they say I need a knee replacement, they say that they got to put screws in my ankle, they say I need mesh. I mean, it doesn't matter where on the body. You got to do your own homework, and you've got to believe in this, so you got to do some research. And I've given you enough research that if you go into my library called Evolve and watch the master classes, or if you go into the Perfect Day Guide and you read about Wolf Non-Surgical, okay, Cell-Sonic Regeneration, Cardio Med Bed, okay, those are the 3 major things. Now, here's what I'm going to tell you. I'm going to tell you the first treatment I do on you that at least I would say 9 out of 10 people, we will increase their range of motion, their strength, and decrease the pain in that knee when we do just Wolf Non-Surgical and Cell-Sonic Regeneration. This is called Cell-Sonic Regeneration. It's 25,000 volts, and it's put into a love harmonic because you couldn't take 25,000 volts. And when it goes in and pulses, it will fracture the displaced calcium, which ionizes it to help it to go back into the bone which it was taken. And then the actual voltage brings your voltage up in your cells back to 0.04 volts is what a healthy cell is. So we can actually take beef jerky, dried cartilage tissue, and we can actually electrify it, and you're not going to be electrically cuted. So, but we're going to electrify it, and we're going to bring life to it. You know, like Frankenstein, it's alive. And you're going to actually know that. So I'm telling you, if I were to totally fail on this one, we would increase your range of motion, decrease your pain, and increase your strength by a minimum of 25% the first treatment. And I'm telling you that after 3 to 5 treatments, you're going to think it was a miracle, and it's not. All we did was have strategy, and your knee returned its synovial fluid. Now you have your cushion back called your meniscus. Your tendons and ligaments all around the area and the muscles have all come back to what they used to be. But you go ahead and you believe what's going on out there. that you need drugs to suppress the pain, which will actually destroy the good bacteria in your large intestine. They'll actually destroy your digestion from your stomach to your small intestine to your large intestine. And even though you're not feeling the pain because of those painkillers you're taking, you're still on fire in that joint, in those tissues. And so the tissues are becoming more like beef jerky. The oil we call synovial fluid that makes that smoothness in your leg will be drying up, thank you very much, and you will be bone on bone. And like I told you, guess what? Whether you like it or not, okay, 50% of all knee surgeries do not turn out well. And they actually cause the next surgery, which will either be a hip problem, or because of what they did here, because you're out of balance, or it's going to be a low back problem. Now, I'm going to be doing a whole series, okay, of these actual lectures. And as time goes on now, I'm going to do what everybody else does, is ask everyone who comes to us if they'll do a testimonial. Because we never ever did them, and we've done thousands of people. And you can believe me or not believe me, but we have had nobody go to surgery for knee, hip, or low back problems like stenosis, okay? And if we are not going to be successful, I'm not here to take your money. I've been at this for way too long, okay? I'm not driven by money. My family's grown, okay? I want to create as many Wolf non-surgical certified practitioners around the world, okay? I want to create as many power pack clinics around the world. That's why we have the best shockwave therapy in the world at the best price with a $10,000 training. You get the Wolf non-surgical certified free, you get the whole life health certified free, you get the woman's pelvic course free, and I will support you and build your business on my platform. And if you're coming to me as a patient, we're going to do a perfect day on you, and we're going to show you where you created the infection and the inflammation without knowing it. And we're going to give you a perfect day, and you will heal. You were created by God Almighty, and we're going to start acting like it. And I'm going to be showing you every part of the body, and we're going to be doing these videos, okay? This is just the first one, and I'll redo this. I'll get better at it, okay? But we're going to show every joint, and and next time, I'm going to show you everything that you need to do. I'm going to tell you everything you need to do if you had this problem. I'll tell you the diet, I'll tell you the exercises, but this is going to end up being probably about 45 minutes, and most people don't have the patience. So we'll make a short one for those people who don't have the patience. And as long as you don't have patience, you'll always remain a patient, and you'll be sold off by the pound. Okay? Dr. Wolf, I am sending you a friend's info. He has been told he has stage 4 esophagus cancer. All right. I want to learn. I want to help myself and sibling. We are all told we have rheumatoid arthritis. There's no such thing. You have infection which created inflammation. I just got to tell you something. There's no 2,200 diseases. There's no 150 autoimmune diseases. There's no 110 cancers. And I would like any practitioner, any doctor, okay, or anybody else, nurse, doesn't matter, come on my show, come live, or just come on a Zoom and challenge me. Because guess what? The body doesn't attack itself. We were attacked by those people we trusted, and they're giving us the wrong information because they're making money off of us. And whether you believe it or not, the same psychos that are running the world are laughing at us and getting off on how we forgot that we were created by God Almighty, and that the body, anything that you created, you can reverse. Oh, I so want to be challenged with that word. Anything that you created, you can reverse it. I so want to be challenged. Where are you? Okay, if I'm a fraud, if I'm trying to sell something that's not right, where are you? Where are you? Come on, let's go. Because I'll tell you something, if somebody wants to come to me and they've got a knee problem, I'll do it live. I'll do it live. And I know I'm in Ixtapa, Zihuatanejo, Mexico, but we're opening in St. Cloud, Florida in the new year. And that'll be really easy for people to get to. It's 45 minutes out of Orlando. And I'll do a live one there too and prove it. But understand something. You got to love yourself enough to want to spend some money and some time with yourself and know that if you don't believe that you can heal, you're not going to heal. That's just it. And that's why I talk like I do. I don't want to take on any patients that don't believe in themselves and their own healing. Okay? All right. So, when a person has this problem, let me just say this. I'm just going to run through what we do. It's not a sales pitch, but you might as well know what's out there. Okay? Here's the deal. We're going to go through your actual diet, okay? And we're going to make it a live it. That would be the first thing. And we're going to go through and tell you how this and this will heal you. We're going to go in and use daily cleansing tea right off the bat. We have to. And we're going to ask you if you would do it every morning and every night for the rest of your life. Costs you about the same as a medium coffee. And guess what? It cleans all your detox organs and mainly your large intestine. And it also helps that you will not, if you use that plus what we call black gold, you won't be having, between the daily cleansing tea and black gold, you won't have heavy metals, parasites, okay, fungus, okay, all right, or chemicals in your digestive tract from your mouth to your rectum. And the black gold goes in and it creates good bacteria better than any other product we know of. And all our black gold is made out of is humic fulvic, comes out of Alberta, okay, out of Drumheller. It's a big mine. And humic fulvic is hundreds of thousands of years old. It doesn't go bad. And it has 40 micronutrients in it. And it'll suck up 300% of its weight in heavy metals, fungus, virus, okay, bad bacteria, and chemicals. So it looks after everything. And if you do something gently and daily, you're not going to have to run to your own rescue. Okay? And then we ask people, you don't have to, but we want them to do the ultimate coffee enema, where they use black gold, green coffee, and an enema bucket to purge your liver, which does 500 jobs. Okay? And trust me, it's backed up. If we can get your liver healthy, it's going to purify your blood. Do you think that's going to help your knee or your hip or anywhere else? If we get your colon healthy, which is 85% of your immune system, do you think that's going to make a difference? Yeah. So what we do is we usually will do a perfect day consult, and that's before people even come to us, because a lot of people fly to us because we're in Mexico, and they'll be able to come to us when we're in Orlando. And we also have another clinic in West Kelowna, British Columbia. So we'll have one clinic in Canada, but the one in Orlando, just outside of Orlando, and the one here, we have what's called DOD 5-star, where people come and stay. We only do 3 people down here. And in Orlando, we have accommodations for about 24 people, okay? So that will be opening up in February of 2026. I just offered you a money-back guarantee, and I'll offer you on the consult, and then when you come to us, okay, there will be some nutraceuticals, but understand something. The more massive action that you take, okay, like actually getting involved in your healing, the less money you're going to spend. And you're actually going to learn how to look after yourself and maintain yourself with very little money, and it's called learning how to love and care for oneself. So after we do the perfect day consult, you'll be able to call me, we'll tweak it, we'll keep going. And even after your knee's fixed, you can call us for free, okay? Because you're going to want to learn more, do more, because you have unlimited potential, my friend. I don't care what age you are, okay? And then when you come to us, the first thing we're going to do is we're going to do cell sonic regeneration. That is this device here. We're going to go in and we're going to do about 25 to 50 pulses per square inch. And what we're doing is we are fracturing the displaced calcium and we're electrifying the beef jerky. Okay? We're electrifying, okay, and bringing life back to the meniscus, to the ligaments, to the tendons. Okay? All right? And to the cartilage that's wrapped around the end of both bones. Okay? Now, once we've done that, oh wow. As soon as you do that and you bring up the voltage back to normal or close to normal, 0.04 volts in the cells, then it's a whole game changer. It's like you just did a personality change on the cells. And they're going, yeah, we're back, baby. So that right away brings back the circulation. right away. As soon as you do the cell sonic, if I had somebody with a knee problem, okay, all right, they got a knee problem, and I just did cell sonic, they're going to go, oh my, what did you just do? And it would take probably 5 minutes just to do the cell sonic regeneration. Now I'm going to go in and do non-surgical, where I'm going to be moving different directions with my elbow, because your elbow can pick up, I can pick up a cyst. I can feel the smallest little fibroid. I can feel what the scar tissue is, or how big the calcium is, the displaced calcium. I can tell you what exactly is going on anywhere in your body. I will map it out first, and we'll go, okay, do you feel that? Yeah. You feel how that's crunchy, like hard? Yeah, that's displaced calcium. You feel that fibrous thing there? That is where the actual tissues now have become more like scar tissue. And because there's been so much inflammation there, your body has sent so much fibrin into the area. Can you please come lower onto my knee? Hello? So when you're going to be, like a lot of people, even if you have a knee problem, you're going to find here, if you come above the knee, it's going to go down, and there's going to be like this little hollow, and that's because of all of the pressure. You don't have enough strength in here, so you're tearing the muscle. And then you're going to find just back about an inch, you're going to find this band of scar tissue. So we're going to do cell sonic regeneration here. We're going to do it on the sides, and we're going to do it on the patella. We're going to do it below the patella, and then we're going to come to the back of the knee. You know, you ever hear of people with a Baker's cyst? Well, that is because their lymph system's blocked back here in the back of the knee, and we're going to do cell sonic regeneration here as well. Then we're going to do non-surgical, which is the elbow technique. We're going to do it on the side and get into all the nooks and crannies and lovingly pull this apart. We're going to do it onto the other side, the lateral side, do the same thing. Get into all the nooks and crannies, loosen up things, get rid of the granulation of crystallization in calcium. We're going to work above the knee, we're going to work on the patella and work below, and then we're going to work behind on the ligaments and tendons and actually work right into the lymph nodes of the knee. Okay, first of all, don't tell me that we don't know what we're doing. We got you. We got you covered, okay? Whether it's your knee, whether it's your hip, whether it's spinal stenosis, whether it's a C7 problem. Oh my God, do you know how many people, they say, well, you know what, you've got lesions, okay, in your spine, and we're really scared that you're going to get your spine cut off and you'll be crippled. We can go in with cell sonic regeneration anywhere on the body. If you don't believe me, this is the strongest shock head device in the world, but it's also the most gentle. You can actually pulse on top of the eyes with the pulse head. That's how gentle it is that you can make it against cataracts, against any type of eye problems. Do you understand? Okay, so that I'm just trying to show you how gentle it is. And it will also go the deepest of any shock head. Compared to a lot of the shock head devices out there, R7 is their 10. So when we're working with real big, like we do a lot of athletes, okay? A lot of athletes. And when we work with athletes, they can take it a lot more because they've built up a lot more scar tissue, okay, from working out and to be this big like a wall, okay? So you get different people. Some people are more sensitive, and then some people are going, I can't even feel it, okay? So, and that's where even personality comes in. But just understand this. The body is a miracle, okay? And understand something. If you were to take a look at the history of health back 110 years ago, every year, okay, we are dismantling the healing powers of the body and saying that we need to replace things, we need surgery, and replacing things like mesh. Nobody, even a hiatal hernia, that's easy. I can reverse that usually in 10 minutes with cell sonic and non-surgical. You heard what I said. That's why you're spewing all the acid up into your chest. An inguinal hernia or belly button hernia, it's going to take longer. But with all the things that I told you, we can do that. Give me a condition, and I'm going to tell you that it's reversible. And that's the God's truth. If you go to bhnuniversity.com, you're actually going to see all the courses that we do. And we do teach the most powerful body work in the world. And it's only 12 days. Okay? And it's only $5,000. And you might go, $5,000? No. you're getting lifetime support, okay? And you're getting lifetime training. And we will also prove to you that you'll be the busiest person within 200 miles of you. Because don't get me wrong, every body work has its place. But chiropractic, they're trying to push the joint back in. Well, what about the dehydration of the tendon, the ligament, the muscle? You can't do that. Until you get the circulation back, the elasticity, you can go and force it in, but guess what? First red light, she's going to pop out. You get rid of the scar tissue and the calcification, which we know how to do with calcium ion therapy, to actually restore your bones. I don't care if you're 80 years old. We have a method to restore your bones back to when you could be a healthy 40-year-old, and that's your bone structure at 80 if you really wanted it. Understand something. That's called a scientific breakthrough. Okay? All right, so understand, don't fall for the scientific breakthrough that is actually a breakdown where they're trying to AI you. That's right, artificial intelligence. They're trying to get us used to replacing the knee, replacing the hip, take the mesh, take the screw, take the rod, take the plate. Okay? All right? And are they giving you a money back guarantee and telling you that you're going to keep all your body parts and that, you know what, you're not going to regret it down the road? Why don't you talk to everybody who's had surgery? And the best case scenario is they did the knee, but now your knee is stiff and it's numb and you don't have the feeling you used to have. How about keeping the feeling, keep the circulation, and keep the youth so that you don't have to watch the sport, that you can still play it? Remember something. You're not getting old, you're getting stiff. You're not getting old, you're getting calcified. You're not getting old, you're losing the lubrication called your synovial fluid. You're not getting old, okay? You're a piece of beef jerky right now. And all of that can be reversed, okay? So tonight, okay, I will be on Heal Yourself, Heal Your Family, 7 p.m. Eastern Standard Time. If you go to BHN University, you can grab the Zoom link, come on live and ask me questions. Okay, I do this once a month. I'll do like every month, I'll do a night, and then every other month, I'll do a day with the doc, which is a longer one, and that's on a Saturday. Okay, so watch out for those. Okay, and if you can't make it tonight, guess what? If you missed it, you can go to Telegram, Doc of Detox on Telegram, and you'll actually be able to find any show. So if you can't find it on Facebook or somewhere else. Okay? And understand something. If you want to test me, go see Dr. Sage Wolf in St. Louis, Missouri, and he'll give you a money-back guarantee. And he has the cell sonic regeneration. They have a cardio med bed there. He's going to be there from July 6th to the 15th, and he's doing thermography, full-body thermography, which is more accurate than any X-ray that's radiating you. And he'll tell you where you're going to be in 7 years if you don't take proper advice and change your personality to change your reality in the choices that you make. More loving, caring choices. Not your fault, but it's your responsibility right now, okay? And he'll be doing consultations, cardio med bed, cell sonic regeneration, Wolf non-surgical, and you've got the same guarantee from him, okay? And then he's going to Los Angeles, California, where he's going to the Transformational Clinic July 31st to August the 7th. He'll also be going to Occidental, California, and if you want to get in touch with Cheryl, but they're completely booked for 10 days. And if you want to get on a waiting list, but I just don't know if you'll get in, okay? And then he's going to Montreal, Quebec. He'll be there August 23rd to September the 1st. Okay, same thing. You'll call Christine, and just go to BHN University if you don't get the information, or just call our 800 number and we'll help you out, okay? All right, and then here's all the places he's going to. If you want to take a snapshot, or go to bhnuniversity.com. And then here's all the courses that are coming up. So right now, he's doing a Wolf Non-Surgical Certified in Calgary, and it's day 3. And then after that course, we'll have in Calgary, the Women's Pelvic Restoration. If you women want to know the holy grail of healing for a woman, it is your vaginal canal, and that's a 3-day training, and you could go and leave this and train other women. This is the holy grail. Check it out, okay, at bhnuniversity.com. The very next Whole Life Health Certified, Wolf Non-Surgical Certified, and Women's Pelvic Restoration training is going to start October the 29th, and it's going to be here in Ixtapa, Mexico. Most beautiful place, I think, on the planet. And we have what's called DOD 5-star that you can stay at, or you can stay at the ICSI Hotel. It's all in minutes walking. Whole Life Health Certified happens in the Braveheart Nation studio. The Wolf Non-Surgical happens at the DOD 5-star healing resort. And the Women's Pelvic Restoration, it will be happening in the studio because we're going live all over the world. So if you would like to attend it, please go to bhnuniversity.com. Then we're going to do the same thing in Los Angeles, and that will be starting January the 14th, all 3 courses. Then we'll be back here to Ixtapa, Montenegro in January doing all 3 courses. And then guess what? Because we're moving into St. Cloud, Florida in February, you'll be able to come there in June and take all 3 of our courses, because that's called the Doc of Detox World Healing and Training Center, where we can actually house 20 to 24 people. Beautiful Airbnbs on Jim Gale's Food Forest Abundance property, where you can get up in the morning, look at the cattle, you can go down, throw a rod in, catch a fish for your supper, or you can just walk along and eat from his food forest, and you can pick any food you want, take it back to your little Airbnb, okay? And that's where we're going to be teaching all 3 of those courses in June. So that's June. We'll be moving in there totally. And just so you know, we have financing on our cardio med bed and our cell sonic regeneration. If you go to dodpowerpack.com, and then if you go to bhnuniversity.com, you'll see we have financing for all our courses. Okay? All right. Just know this. I promise you, and I make this a promise, I will always give more than I take, because guess what? We have unlimited potential when we find our true authentic self. Okay? And that is the God's truth. And I want everyone to understand that. Okay? All right? So I would like to just tell everyone to have the best day of your life. Okay? And understand something. Question everything. Question me. And you have that chance tonight. 7 p.m. Eastern Standard Time. You can come on any of our platforms, ask your questions on Restream. Or if you want, you can get the Zoom link at BHN University, and you can actually, okay, call me, okay? Not call me, but come on live on the Zoom, okay? Understand this, we were created by God Almighty. Let's start acting like it. 3, 2, 1, you got this, Bravehearts.